Okay, in this video we're going to talk about the hand and wrist palpation. This is all new content, this is all new material for you guys, and so this video will be just a little bit longer as we describe how some of this is supposed to feel as we're going through and doing this palpation. When we start with the radial ulnar joint, which we're using the distal aspect of this radial ulnar articulation. And so one thing that we can do while we're palpating, what we're going to palpate for here is an A to P or a P to A glide of either of these long bones. We can stabilize one part. So one thing I can do is I can take my hand and I can hold it along this radius, and then I can pinch grip that ulna, and I can challenge A to P and P to A. While I'm stabilizing the radius, I'm only assessing the motion that exists over on the ulna. Likewise, I can do the same here. If I stabilize the ulna, I can come in and do a pinch grip on that radius, and I can challenge A to P and P to A there. The last palpation for the radial ulnar joint is actually an orthopedic test called the Bracelet Test, and here we call it compression. What we're doing is we're going to wrap our fingers around and then we'll squeeze, and we're approximating those bones. If we have pain in this area, if we have pain with this test accompanied with labs and other clinical presentation can be an indicator for RA. So bracelet test is an important test. We should be able to feel those two long bones kind of approximate and then rebound. We'll move on to the intercarpal joints. So when we're talking about the intercarpal joints, we're talking about the two rows of carpals that exist. So there's a radius and ulna, and then the two rows of carpals. And one common mistake that students make is that when in an exam situation you draw a line like this, like the carpals are two lines that sit like this, and that's not the case. If you remember from your anatomy class, the radius and the ulna come down here, but they've got these kind of styloid processes on either side, and that creates this little bit of a U. And in that U, there's all of those carpal bones that sit kind of like this in a curved presentation. So it sits kind of curved here, and then the other curve sits just like this. So when we palpate that, we need to make sure that we're able to identify each one of those rows by doing that. So I'll pinch grip the distal radius and ulna here, and then I'm going to grab that first row of carpals, and I'm going to shear. So I'm shearing kind of this A to P glide here. And as I'm shearing, I'm taking that first row and its articulation with the distal radius and ulna, and I am assessing that whole row's motion. And then I can shear the intercarpal joint, the true intercarpal joint, which is the articulation between those two rows of carpals. And I can do that very similarly by pinch gripping the proximal row and then the distal row and shearing those as well. And then I can shift down one farther and contact that distal row of carpals and then the metacarpals themselves and shear here. This is a good assessment for identifying restrictions in those rows so that you can follow it up with a more specific palpation of the carpals themselves. Other palpations that we do with the intercarpals are a long axis distraction. So here we're basically going to shake our patient's hand. We'll grasp that distal radius and ulna here, and then I'm going to decompress those carpals and then allow them to reset back. We feel the most here when we're resetting it back. Uses a lot of bigger muscles to do that initial pull. So when we pull here, we're not really feeling a whole lot, but as I let go, I should feel a nice rebound. If I don't feel a nice rebound, it probably means I didn't have a very good distraction. I'll probably go in and further assess those intercarpals or the intercarpal articulation. The last four are medial to lateral, lateral to medial, glide, and tilt. So what we're doing here is we're assessing tilt. When we tilt, we'll do lateral to medial here, and I'm going to use the hand to help me out. So the hand is going to tilt in, and then the hand is going to tilt out. So we would call this radial deviation and ulnar deviation, right? So you should have, at the end of that motion, you should have a nice spring here as we challenge the ligaments on the medial and lateral aspect of that hand and wrist complex. So as we're going through here, this is as much of a carpal palpation as it is a ligamentous palpation too. So remember, these carpals here, they're rolling on one another as we go through this palpation. And so when we're assessing for that roll to exist while we're tilting here. And then the last is glide. So what we'll do is we'll use that same contact that we used for that bracelet test. So we'll use a ring contact around our patient's wrists. And then I'm just going to challenge. I'm going to shear with this medial to lateral and lateral to medial glide on those intercarpals. And we can make this really specific by using the same technique that we used when we did an A to P and a P to A joint assessment here. So when we did that, we did a glide here, moved to the true intercarpal joint, another glide, and then the distal row of carpals and another glide. Okay. From here, we can go through and do our palpation of all of the carpals. And so when we do that, I'll pick on lunate here for you guys. I want you to be able to palpate and go through them all. So make sure that you're palpating whomever is at your house. If you're by yourself, you've got another hand, right? So palpate each one of those carpals, please. We're going to pick on the lunate here. So lunate sits right here. And what I want you to do is grab a pinch grip. So just like this, right? And that isolates that bone very well. So a nice pinch grip. And again, this is something maybe where I did an initial palpation of those intercarpal joints and I felt it was restricted. And now I'm going to do that individual bone assessment. And I can go through and assess all of those carpals the same way. I want you to run through all of those carpals. So in a testing environment, I would hope that you would be able to palpate each one of these carpals and tell me that you're moving A to P and P to A. Next are the metacarpals. Metacarpals are really easy. So they're the long bones that sit here, right? And all I want you to do here is I want you to pinch grip and shear between them, okay? So we should be able to shear between each of these metacarpal articulations. The last articulation is this metacarpal phalangeal joint. The metacarpal phalangeal joint will start by isolating here. So I'm going to grab here, and my job's to stabilize the hand. As I kind of get a pinch grip on the phalange, I'm going to distract a little bit. I'm going to circumduct. I'm going to do a medial to lateral and lateral to medial joint assessment, an A to P and a P to A joint assessment, right? And then I'm going to move down into the interphalangeal joint, and I would do the same thing there. So proximal and distal interphalangeal joints, we can assess those in that same manner. And that is our hand and wrist palpation.